Here's the second patient, Loren. I was treating Loren's mom for Hashimoto's disease, an autoimmune problem with the thyroid. And Loren's mom was complaining in the summer. She was cold. She's laying around. She doesn't want to do anything. She's grouchy. And this has gotten worse over the last 6 months. So Loren's got this puffiness under her eyes, and she's got these what I call allergic shiners. Looks like she's got black eyes. She had slow reflexes. Look at her hair. You'll see the next slide for comparison. She had basal body temperatures 1.5 degrees lower than normal. She had normal thyroid blood tests. I made a clinical diagnosis on history and physical exam and basal body temperatures of low thyroid, and put her on a small amount of desiccated thyroid. And this was her 4 months later at a recheck. So, again, she's old enough, she likes that with her hair, she's a patient for life. But look at her face. The allergic shiners are gone. She's no longer tired, no longer irritable, feeling her normal self. Here's a recent, actually there's become a little bit old now. There's certainly newer pictures. And what we found is as she's gotten a little bigger, gone through growth spurts, we've had to adjust her thyroid a little bit. So this is an N of 2 where the thyroid tests aren't picking it up. Here's the N of 3. This is Alec. Alec, I asked Mom to bring in this picture for me. I would assume he's about 6 months old here, and I hadn't seen him yet here, but I could look at him and make this diagnosis. Look how puffy he is under his eyes. Now here's Alec when I first saw him. And I walk in the door and I'm holding the chart in one hand and I got the doorknob in the other hand. And the parents are there. That's him in that room that day. I don't introduce myself. I open the door, I'm standing there, there's this pregnant pause. And I felt like it went on for minutes, it probably went on for 20 seconds. And I'm staring at him, he's staring at me, the parents are staring at me, probably thinking, what's up with this guy, why won't he talk? And the first words out of my mouth were not, welcome, I'm Dr. Brownstein, nice to meet you, what can I help you with? First words out of my mouth were, he's myxedemic. And the mom said, what's that? And I said, he's severely hypothyroid. And what I was struck by when I looked at him, his tongue was so big, it was sticking out of his mouth, and drools coming down him. It's hard to see in the picture, but he's puffy on the wrists. People with severe hypothyroidism who are myxedemic get puffiness on the wrist and the top of the ankles. And so when I made that comment and I said what it was, she starts flipping through papers, and she hands me a paper and says, we just took him to the doctor. He said his thyroid levels were normal. He had normal thyroid blood tests. So Alec's history was he was a cerebral palsy baby. And he came out with health problems. He was having seizures from birth. They put him on seizure medications right from birth. When I saw him here, he was taking 3 seizure medications at full dose and having 30 seizures a week. Getting no better. We're adjusting his medications and putting him on new ones and switching them. He's not getting any better. So, Alec has normal thyroid blood tests. However, on on history, mom's complaining he's tired all the time. We didn't know if it was the seizure medications that he's on. He's constipated. He's cold all the time. He had a low basal body temperature. On physical exam, his thyroid was definitely puffy when I palpated it. He had slow reflexes on physical exam. So I made a clinical diagnosis of low thyroid, hypothyroidism. I put him on a small amount of thyroid hormone. And here's the change in Alec. Now, Alec, being a boy, he didn't care about his hair turning curly. But his mother liked that. This was 4 months later. Alec's tongue receded back into his mouth. He still had health issues. He went from 30 seizures a week and 3 medications full dose to 3 seizures a week at 1 medication at half dose here. He's still got health issues. We've had to adjust his dose as he's gotten bigger. But Alec has done remarkably well. He went back to the neurologist after I put him on the thyroid meds, and I warned the mother what may happen, that the doctor might not be happy about this. The doctor, to his credit, she said it was like a carbon copy of my visit. He opens the door, looks at Alec. She said he just stood there for 10 seconds. It was a pregnant pause. And he said, he looks really good. What are you doing? And she told him, and he flipped through the chart, and he said, I just checked this. It was normal. And she said, to his credit, he closed the chart and said, whatever you're doing, keep doing. And what I found after treating Alec was that anyone with seizure disorders, they seem to get better when you get the thyroid working better. The seizure frequency goes down, many times it goes away. And really, doing a full hormonal evaluation with a seizure disorder patient has rarely failed to help somebody with seizure disorders. So that's an N of 3 with a thyroid blood test, don't pick it up. And here's my last one. Here's my fourth one, Dawson. This was an email I received from Dawson's mom. I thought you would like to see Dawson's latest report card. He used to be reserved and did not want to interact socially. He's been on Armour Thyroid, that's the natural thyroid, for 6 weeks now, and his teacher has noticed that he has changed in personality and attentiveness. Maybe all the kids being diagnosed ADD are really hypothyroid. I'm so thankful he had help available to him. My mom commented at Easter that my kids were like 2 different children. I agree, Dawson could not sit in his chair at mealtime. He was up and down and up and down. It drove us crazy. Now he sits through the entire meal and eats. I've not heard that his stomach hurts, which used to be every night since the first week he was on thyroid meds. I was treating Dawson's mom. She had thyroid cancer, went through 3 rounds of radioactive iodine, which almost killed her in the 3rd round. And she got pregnant after all that, and the thyroid wasn't straightened out, and the kids ended up both having thyroid problems. So that's what I was treating Dawson for, what was in her email. But after he did better, about 6 months, I get a phone call from her saying, he's up and down, up and down again, everything's back, it's not working. So I said to her, and part of the phone call was he failed the spelling test he took. I practiced him the night before, he knew every one of these words, yet he missed most of them, and he brought in some aliens to help him, which didn't help him. And she said his handwriting was awful on the spelling test. I'm like, well, his handwriting isn't that bad when I looked at it. I mean, my patients know that kind of looks like mine. But I don't bring in aliens to help either. But so I said to her, is he in a growth spurt? She said, yeah, his pants are short. Have you checked his basal body temperature? She was doing it at first, and then when he got better, she just stopped. So she checks his basal body temperature after that, calls me up and says it dropped back down. It came back up when we went on thyroid hormone. He had normal thyroid blood tests before I treated him. He had low basal body temperatures and slow reflexes. The common picture I see where he could meet the clinical signs of hypothyroidism at normal blood tests. So now his basal temperatures, which had come up, had dropped back down, and I said, well, he just needs a little more thyroid hormone. He's going through a growth spurt, which is common in kids. So I had her increase his thyroid by 1/4 of a grain, and you can see the dates on here. This was 11/7, this was 11/18, 11 days later. Now, Mom says that he had been on the new thyroid dose for 7 days by the time he took this. And she says she didn't practice with him the night before. She took him into school because he was better about 3 or 4 days into adjusting his thyroid dose. So she asked the teacher to redo the spelling test that he failed. So this is your brain on hypothyroidism, and this is your brain with enough thyroid hormone. So no more aliens, no more scribbling, he's in the lines here. He missed a few words, but not too bad. And that's as powerful as those pictures. So this is an N of 4, and let me tell you, between me and my partners, we've seen a lot of patients with this, and I've written about that in my books.